There was a great research study that was done by Lisa Stoltz recently that was published in the Journal of Sports Physical Therapy. And what Lisa was looking at, she's one of our Polestar educators and known Lisa for years, she was looking at the predictive role of how Pilates can affect people with mechanical low back pain. And so these prediction rules could identify subgroups of patients with low back pain that were most likely to benefit from Pilates-based exercise. This is the type of research now that's coming out that's helping us understand if it is an instability problem or if it is radicular pain or what other factors in the individual would best predict that this person would get better. She found a number of factors that were very interesting, 3 or 4 of them, that would predict that these people would get better with Pilates intervention alone. Some of those were being overweight or a high fat body fat index. Others were that the pain didn't go below the knee. And another one was that the pain was localized in the lumbar spine. So when we look at these kind of factors, we sort of can start predicting and have a better understanding of who is going to best benefit from Pilates. We've seen so many people with different back and spine pathologies benefit that now we're starting to understand why. And I think the biggest thing is it goes back to this principle of axial elongation and core control, that when we place the spine in its optimal position and we give it the appropriate amount of stiffness, it has its greatest chance of healing and performing well and minimizing the insults that cause pain. And it doesn't mean that some people aren't going to need surgery, because they will, but what it does mean is that we minimize that risk. We optimize your performance, and that's why so many people do well with Pilates intervention with back pathology. Some people ask, what are some of the reasons for faulty organization in the spine? Well, I've sort of narrowed it down to 3 areas. The first one is a genetic predisposition. There really are familial traits of the spine and of how our body's organized. Some people might have a leg length discrepancy or a scoliosis or other genetic predispositions, family history of spine disease, those kind of things that do exist. And in those cases, we do what Eric Franklin talks about. He says that optimal alignment is when the body structures come in as close to the central axis as structure permits, and the center of gravity as low as structure permits. So the idea is that anybody with any pathology can still have their optimal alignment, and that's what we work towards in Pilates. So we do the best we can. The second one is habitual patterns. Now, I think this is probably the largest, because just sitting is probably one of the worst habitual patterns that we can do for our spine. But the idea is that we sit with our legs crossed, we slouch, we sit down. Gaming has become a huge thing now, so our youth are spending hours and hours a day sitting in slouch positions. They're in school, they've minimized their exercise. Whatever our habits are, we drive on one side of the car, we have an arm out the window, we have the other hand on the steering wheel, our foot is always on the gas or the brake. These types of behaviors and habits predispose us to certain patterns that could be harmful to us. I also bring this up because every sport, every activity has a bias. When somebody comes to me, you could line up 6 dancers on a wall, and depending on what type of dancing they do, if they were serious dancers, I could tell pretty much, as well as many other dancers, could tell what type of dancing they did. If they were ballet, modern, ethnic, tap, jazz, show dance, by the way their body has adapted to the activities that they engage in. There's another saying that is, we are what we practice. I believe that's also another Eric Franklin quote, that our body will look like what we practice. If you look at a football player versus a soccer player versus a swimmer versus a gymnast, it's very easy for us to determine that they have different activities based on the nature of their body. So our habits depict what we look like. Pilates and some of the other type of body awareness exercises actually are neutral. The idea is to neutralize the effect of some of these habits. So if I have a sport that has an extension bias in my low back, Pilates could help me balance out that extension bias by doing some flexion exercises. If I have a bias of external rotation in my hips as a ballet dancer, Joseph Pilates would have them do work in neutral and internal rotation of their hips to be able to balance out the effect of always being in that position. If I have a huge hyperlordosis because I wear high heel shoes and that's what I wear and stand and work in that position all day long, I might do more flexion work to try to balance out the alignment of your lumbar spine to prevent things like stenosis and degenerative joint disease in the facets as you age. So habitual patterns are in all of us. Pilates is a balancing and neutralizing activity that gives us an increased range that allows us to minimize injury, optimize performance. It is as simple as that. The third one is compensatory patterns. Now, as a physical therapist, I see this all the time. It's like the onion. I'll have a patient come in, they'll say, oh, my shoulder's really hurting. Can you take a look at it? So we look at the shoulder, we fix the shoulder. They come back the next day and they go, you know, my shoulder feels a lot better, but funny enough, I got a pain here in my neck that I had 6 months ago. And so we fix the neck, and they come back and they go, oh, my shoulder and neck are feeling better, but you know, my right sacroiliac is hurting now, and that's a problem I had, 2 years ago. So it's like the onion. We peel the layers off. These are all compensatory patterns. Every time we have an injury, we tend to develop a compensatory pattern to be able to heal and to protect ourselves. Not all compensatory patterns are bad. Many of them are necessary in order for us to function. We use this all the time in neurological rehabilitation. Function is the primary goal. What we do notice is that there are pathological motor control strategies that do more harm than good. And this is where in Pilates we can just keep facilitating good alignment, good organization, good control, good efficiency that will help eliminate some of those pathological movement or motor control patterns and strategies that tend to get in our way. I'll give you some examples. If I have a hip pain and I go into a hip flexor strategy to try to protect myself, what's going to happen is every time I toe off in walking, it's going to pull my spine into a shear force. So what happens is I might not notice after a while that my hip flexor is tight, but I start having back pain and maybe even stenosis from repetitive strain of that shear force in my low back. Before we can fix that low back, we have to go in and open up that hip. And so we would work on getting rid of that hip flexor strategy. Another really important component to compensation is fear. A lot of times what people experience when they have pain is fear, and so they associate movement equals pain. One of the things we do in Pilates is we try to create these positive movement experiences that teach them that movement equals happiness. And by having these positive movement experiences without pain, they can start believing and having hope again that they can be restored to normal movement and not have to deal with these kind of pathologies for the rest of their life, or at least not with the symptoms of those pathologies for the rest of their life. So again, just reiterating, compensatory patterns can be normal and healthy. They could be pathological and cause more problems, or they could be due to psychological and fear-based or emotional-based feelings of fear and apprehension. The acquisition of new or correct movement is purely done by facilitating awareness of optimal alignment and appropriate movements, these successful movement experiences without pain, and to minimize the compensations or compromises that actually cause stress to the tissues and to the body. We refer to this as improved postural awareness, and this is a fundamental, foundational part of Pilates. All Pilates teachers are very aware that what we do is we facilitate improved postural awareness. And any movement style, any movement technique that does this is going to have a similar effect, right? So whether it's Tai Chi or yoga, gyrotonic, gyrokinesis, these systems that bring awareness to posture are all going to help us with the same thing, bringing awareness to that axial length and establishing movement in a way that minimizes risk of injury and enhances our performance. The last thing that I want to share with you regarding axial elongation is the bioenergetic section. And it's looking at how energy flows. When we talk about chi or prana flowing through our body, we often talk about, first in prana, the root chakra, and how the hara, or the center of our body, is the energy source, and we start moving that energy up through our body. So a lot of times, Pilates' natural effect of organizing the pelvis in relationship to the legs and to the ground, and the pelvis to the spine and the organs, really is, in essence, an energetic work. I remember very early on when I was learning Pilates that I would take time in the evening to practice Pilates as different systems of the body. So in the beginning I would look at the skeletal system, the muscular system, the nervous system, the cartilaginous system, and then digestive and circulatory. Years later, went back and played a little bit with what happens with energy. what happens with chi and with prana as I move my body in a roll over or a roll up or into extension, and how does my breath change, and things that I noticed watching people doing things like the swan when they held their breath and had poor alignment. You could see the loss of energy in their face and around their body, versus somebody who had fluidity. You could see the flow of energy and light around their head and around their neck and shoulders and space. And so one of the things we look at, and we are understanding more and more, is that when the fascial system is organized well and balanced through the body, that the energy is flowing well through the body. And that good flow of energy could tie into what we would refer to in Chinese medicine as the meridians and the qi flowing. And the idea in Chinese medicine is if the qi is flowing, the body will heal itself. It's different from Western medicine where we just want the pill or the surgery that's going to cure us. When we move well, we do the same thing as acupuncture by freeing up the flow of qi and energy through our body, and our body is in a better position to heal itself and to be healthier overall. This is one of the fundamental principles, axial elongation and core control in Polestar, that we feel is the essence of what Joseph Pilates taught, of being able to move effectively and efficiently and to do our daily activities with a natural vigor and zest.